Hi, my name is Susan Bentley, and we're here with the Wyoming Family to Family Health Information Center talking about the importance of proper medication use for you and your child with special health needs. As I said, my name is Susan Bentley. I work with Uplift, which is an advocacy organization for families of children with mental health needs and developmental disabilities. I have raised 4 kids, 2 of which had special health care needs. And so this is a topic that is interesting to me. And I would like, if you would please introduce yourself.
So my name is Carol Kobelnicki, and I'm on faculty in the School of Pharmacy here at the University of Wyoming. And I teach in the pharmacy school. I teach pharmacy students to be hopefully better communicators and to learn more about really how to assist individuals in the community with their medications. And I'm happy to be here today to talk about proper medication use.
I really appreciate it. Thank you. So tell me a little bit about how a parent would know whether or not they had the right medications for their child. What are some just brief guidelines?
So some of the brief things to think about, certainly anything that the physician is prescribing, there's a trust that has to be there, a trust relationship. And as far as things that can be purchased without a prescription, I'll be showing you some slides here in a moment that often it's in the fine print, whether it says it's appropriate for children. Sometimes it's obvious if it has a little cartoon on it, maybe, but maybe not.
Right.
So you really have to be careful and read the fine print.
Okay.
Yeah.
So just kind of jumping in, what sort of information should I share with my primary doctor and my pharmacist?
Yeah, well, one of the big things that I tell my students as well, and I like to tell people in the community, is that you really need to share all the things that your child is taking. And so this, realizing that sometimes your child may be seeing more than one doctor, more than one prescriber, and this includes people like dentists. Dentists prescribe medications, nurse practitioners prescribe medications. And so, it's not just from the one main doctor, maybe the family doctor or the pediatrician, but there's so many other players. So sharing what prescriptions are given to you by all of these different individuals, as well as, like I said, things that you don't need a prescription for. And there are a lot of things that we consume as adults and that children can consume that can influence the way that their medications work, whether they're effective, whether they work the way they're supposed to, or whether they're safe. And so a few things that we have here on the slides, some examples, common things like Tylenol and Advil that we use maybe for fever or for pain. It might seem trivial, but it is really important to let both the pharmacists know where you get your prescriptions as well as the doctors that these are the medications that I'm giving my child, and these are the instances when I do, and this is how much I give. And that really provides a check and balance so that if you are saying that you give your child Tylenol and the pharmacist sees that another product actually has Tylenol in it, they're able to then say, oh, wait a minute, you're double dipping here and you're giving twice the amount that you intend to, so let's make sure we change this. Things that you might not otherwise pick up. I also have listed here things like vitamins and other supplements. It is important and relevant to let your doctor or the pharmacist know that the child is taking a multivitamin, for example, or some children will take iron supplements. I also have on here, protein drinks or Ensure or those different types of things, because that can not only affect how the medicine is absorbed into the system, but it also can, just affect how the medicine will work in the body. So it's important to have that information. And I did want to stress herbals, and I know that's always a really popular topic with people. And I'm very aware of the fact that some people really hesitate to share that with their doctor. They might feel like they're being judged. You use herbals, why do you use herbals? Those kinds of things. Or even by their pharmacist, but really it's important to share that information and to let them know, because we are finding, there's more research coming out to show that some herbals can be beneficial. Of course, they don't always test them in children, so that is certainly something to keep in mind. But herbals can interact with prescription medications, with over-the-counter medications like Tylenol, those things without a prescription. And so having that full information is so critical. And if you don't give your doctors and the pharmacists that full information, then they really, they can't help you make the best decisions for your child. So.
Right. And I think a lot of times with the herbals and the homeopathic medications, I think folks don't tend to think of those as medications. They're natural remedies, and so they don't think of those. So that's really great.
And really related to that, even with the things like vitamins, and we think they're safe, but they're not necessarily any safer than prescription medications if they're not used properly. So, just because it's something without a prescription or it's a natural product, it doesn't necessarily mean it's safe.
Okay.
So, yeah.
That's interesting. So, tell me a little bit about how you would tell what medications are designed for kids. Over-the-counter meds.
Okay.
Prescription meds, I'm assuming doctors will prescribe, but over-the-counter meds, what's some of the things to watch for?
So over-the-counter medications, so first of all, I do want to mention that medicine that is designed for adults and perhaps older children is not really intended for younger children, that it is important to keep those separate and to realize that yes, it might be the only thing you have in your house, the medication that you might take, say for a cough or something, but it can be a very different formulation with different ingredients, different concentration, different potency than the one that you would give your child, even if you gave them the same medicine. So one thing to, an example, a classic example is something like decongestants. So in the last few years, the organizations that really oversee pediatric care or health care for children have come out to say, children really should not be getting decongestants. These are the medicines that are used to clear up those stuffy noses.
Right.
And they just don't, the research just doesn't support that it works in kids and that it's worth it in terms of them having side effects from it and so on. And for those of us who might have grown up using them or we gave them to our children earlier, they're just not, they're saying not to do it anymore. And so what that means is that you're not going to find the products out there for children. So that's one example. So then what happens is if you really want to give that to your child and say, well, I don't care what, my doctor says, I'm going to do it anyway, well, then you're reaching for an adult preparation. And then you're going to run into trouble because then it's the question of how would I even dose this? So it's really, that would be a classic example of staying away from that unless you talk with your doctor or your pharmacist and they say, yes, in this instance it is appropriate and this is how we'll do it. The slide that I have here, so the fine print is crazy. It's so tiny. I mean, I had to enlarge this so much to get this even on the slide. But every over-the-counter medication has this kind of format with the drug facts. And thankfully, the Food and Drug Administration that oversees all of this, they made that to be standardized, or they insisted that that be standardized and simplified to some extent, probably about 10 or 15 years ago. So, and if you scan down, it has information. It always tells you what the active ingredient is, which is really important to realize because some of those active ingredients may not be appropriate for your child. And so you might say, well, it has this ingredient that I want to give, but some of the other things may not be appropriate. And so, and you might not know as a parent, but again, asking those questions of your healthcare professional. When you scroll down, under the word directions is where they do talk about dosing and how much to give different people depending on age, and sometimes it's depending on weight. And on this example, this is a decongestant. It says children under 12 do not give to children under 12 years of age. And so you really do, I guess, to ultimately address that key question, you have to look at the fine print, and it's typically under directions within that drug facts box on the packaging. And the next slide, I just want to point out, here it says retain the carton for complete product information. A lot of times we just throw it away. Yes. We throw the box away and we keep the bottle on our shelf or in our bathroom, and then we lose all that information. So it really is important to keep that carton, because even if you don't read it at the point that you come home from the store, you're going to regret that you threw that away.
Right.
So hold on to it. And sometimes it comes with even a printed piece of paper. Keep that in the box too, because it's a good reference. Yeah.
Okay. So, do you have a couple of examples, maybe, so we can get a better idea of how that would work?
Yeah. So, I prepared something here about ibuprofen. So that's a really common medication that we give children, babies, that are teething, they're having a lot of pain, or maybe there's fever. And so I wanted to just illustrate how these two examples here in the blue boxes, they're both for children. One is for babies, one is for children who are a little bit older than that. And when you look at the numbers, they're different concentrations. And so that means that you really have to pay very close attention and give the exact amount that it says on the bottle itself and on that particular package. So I'd like to just work through a couple examples.
That would be wonderful. Thank you.
So here, the picture here is just an oral syringe, and what that means is it's something that you pull the stopper back and pull up the medicine, and then get it to the exact amount that you want, and then kind of shoot it in your child's mouth. Okay, and in this example I have here ibuprofen infant drops for babies. So this also might come with a dropper, but if it doesn't or you threw it away, then something like an oral syringe, you can ask the pharmacist for one, and I imagine they would have. I know they keep them in the back within the pharmacy. So a typical dose for a baby who is, say, 12 to 17 pounds, a very young baby, would be 1/4 of a teaspoon. Well, you can imagine holding a teaspoon. You can't possibly do that with a teaspoon. So you really have to use this kind of equipment. And that would deliver 50 milligrams of the medicine. Now, if you, and these packages are usually about this tall. They're pretty small, okay, because you're only giving just such tiny amounts to the baby. If you were to use a child's liquid suspension, that's going to be a bigger bottle, and it's going to contain a different proportion of medicine. And so in this example, if you accidentally reached for the wrong one and you thought, well, I'm used to giving my baby 1/4 of a teaspoon using this little syringe, and you use the medicine for your older child, what you're going to do is you could potentially give them only half the medicine that they really need. And so it's not going to be effective, basically.
Interesting.
Yeah. So, and not all of the liquid medicines for children are like that, but you do have to be very careful. You have to be very careful. And I'll show you kind of the flip side of that. If you were to want to give say 5 milliliters, or the equivalent of a teaspoon in this syringe, it goes up to 5 milliliters, and you draw that back of the medicine that's intended for the slightly older child, then you would be giving a correct dose, okay, the 100 milligrams. If you accidentally reached for the baby stuff, the baby medicine, and you drew up that same amount thinking, well, that's the only one we have on our shelf, I'll just use that, then you would be giving them twice the amount of medicine than you intended. So you'd be giving them an overdose.
Wow.
So, I really wanted to stress that it's really important to make sure that you're following the exact directions that correspond to that bottle of medicine, and that you don't interchange those. So.
And that is important. I know that I have thought, small children, babies, kids under 12, pretty much we're all the same. So that's really good for clarification. Thank you.
Yeah. I'm going to just show you a couple more things.
Absolutely.
Obviously it's really difficult. Like I said, you can't really take a teaspoon and measure 1/4 of it. How could you possibly measure that? Even if you try to get out your measuring spoons, that you bake with or something, that's kind of tricky too. So what they recommend is, they have a lot of different kinds of equipment essentially that you can use to give medicine to children. And the best default, I guess, is to use what they have included in the package, and to use that one. For baby drops, it could be a dropper, or they might have an oral syringe like the one in the picture earlier. But there are also these dosing spoons, the little containers, or the little cups, and so on. But that is much more exact than using a teaspoon, because teaspoons can vary so much. So.
I found with my kids that the syringe was very helpful, because you can get past the taste buds.
Oh, yeah.
If you've got medicine that doesn't taste great.
Yeah, absolutely. And actually, I don't have it on a slide, but so I have children myself, and I know one of the, it is difficult giving medicine to a child, and especially if you're the only one there,
right,
and you've got arms pushing it away, and and one technique that it sounds a little bit strange, but it really works quite well, and I think it's very humane, is to sit on the floor and put your legs out in front of you, and you have the medicine all ready to go, and to put your small child between your legs with their head closest to you, facing up. And what you can do is you can effectively hold their arms and their legs down with your legs. You're not trying to pin them down in a aggressive way, but that way they don't have the arms to push the medicine away.
Right.
And then you can focus on, holding their head or their face and reassuring them, and with the other hand administer the medicine into their mouth.
Right.
So I have found that to be really effective with very small children who are very unhappy about getting medicine.
I can see that. I can see that.
Yeah. So that's a good technique.
So how do you take care of these kinds of equipment?
Yeah, so definitely want to wash them. I have a little bubble slide. Some things are harder to wash. Even just rinsing it out several times. Keeping in mind too that if you're not washing it out with soap and water and you have several children, you might want to even put their name on it if you're having to use it over and over again for one child and then have a different one for a different child. Just to keep the germs separate.
That's a good idea.
Yeah. I know we don't always think about that, but and if you don't rinse them out immediately, they of course get very gunky and very difficult to clean. So I know just when I have used things, even with the oral syringe, just drawing up water, squirting it out, drawing up water, just to really get it cleaned out for the next use, and to do that quickly before it dries. Yeah.
Makes sense.
Yeah.
That makes sense. So in a pinch,
yeah.
What about giving adult medicines to children? Can you cut that down?
So I would recommend against that, truly. Again, one of the reasons is that they can be concentrated differently, and so it can be really tricky if you're looking at the math and trying to figure out how much do you really need to give. Also, adult medicines can contain other ingredients that you may not want your child exposed to. It could be another active medicine. A lot of our medicines, for example, cough and cold products, contain 2, 3, 4 medicines within the one. And so, some of those may not be appropriate for your child. And so, then they could suffer side effects from it, or, certainly unintended consequences. They also can contain things like alcohol. And the reason they put alcohol in some medicines is because what they're trying to do is they're trying to take a powder and get it into a liquid when we're talking about these liquid medicines, and sometimes it doesn't dissolve in water.
Oh.
And so they have to use the alcohol to dissolve it better. Now, if it's a child preparation, they won't put the alcohol in, but what they'll do is they'll create something to make a suspension. And a suspension really is, it means that some of that powder, some of that undissolved medicine is still in there. And that's why it's just so important to really shake it. Whenever you see those labels that say shake well, they really mean it. It's not just, and you're done.
Right.
But I like to turn it upside down, turn it right side up, turn it upside down, because what you're doing is you're getting undissolved medicine that has settled to the bottom, mixed in throughout. I think about how, sometimes if you use those oil and vinegar dressings, right, it separates out, and you need to somehow mix it, or else you're going to pour out a bunch of oil onto your salad, right? I mean, it's the same idea, but of course it's a much more important thing,
Right.
And so, so you do really want to shake it up really well. And
that's good to know.
And I think my sense is that children's medicines are more likely to have that suspension because they don't want to add the alcohol. And so you have the drug at the bottom to mix up. So
that makes sense. So what other advice would you give us?
Well, I'm sure everyone knows this, but just a reminder to really read the labels. And if you don't understand something on a label, then ask. Pharmacists in particular. So I'm a pharmacist actually by training. I don't practice actively anymore now that I'm teaching, but we're accessible in the community. You can call a pharmacy and you can say, I have a question for the pharmacist, and you might have to sit on hold if there are other pressing matters, but ask if you don't understand a label. And so, again, I mentioned that things can have more than one ingredient, and that's a big reason to read the label. We talked about how medicines can have different concentrations, and so that means it affects how much of it you give. And so that's, of course, really critical to read the label, and that you don't want to ever double up. So, you might say, well, here's the Tylenol for my child, but what if they're taking Tylenol in some other preparation? Again, that's a big red flag. You don't want to do that.
And that's fairly common. Is that correct?
It is, yeah. And that's, when I think about cough and cold preparations, especially, and really the adult preparations are especially characterized by having lots of different ingredients, things like Dayquil or, lots of different medicines in it. And that's certainly the topic for maybe another webinar for another group of people. But to really pay attention to that and to not give the same ingredient twice.
Okay.
So yeah. Another thing is to give medicines as written. Sometimes we like to experiment and say, oh, well, maybe this will be okay, but it's really important to do it as it states, and again to stress that idea of keeping the box, keeping the written information so that you have it. I know of people who, they might recycle cardboard, and so they're unpacking their groceries and they just bought medicine and they take the cardboard and they want to recycle it right away, but really keep it with the medicine.
That's good to know.
Yeah.
And I think there's a mindset that if a little works, a lot will work quicker, faster.
Oh yeah. That can be certainly the mindset, and these doses that are developed, these are studied. They study these in large groups of people, and they do the research, and they determine, what amount of medicine works best, and the timing of it, and there might be with some medicine there's a little bit of wiggle room, but that's allowed within what they print on the instructions. Is acknowledging that people are a little bit different. There are some exceptions to that. Some prescription medications, they have what's called a narrow therapeutic index, which means that you really have to tailor the amount very carefully for the individual. But that's only the case really for those prescription medicines, and then the doctor and maybe the pharmacist or maybe a nurse is working with you and your child to make sure that your child is getting exactly the amount that they need. And that might involve things like blood draws and other things to make sure that it's exactly what they need.
Right.
But these things that we can buy without a prescription, where you can just walk into a grocery store, they have they're pretty forgiving, I think, in case you have slight differences among people. But to stick with their guidelines is the safest thing.
Well, let me ask you another thing regarding medication. If you miss a dose, is it common practice that you double the next dose, or how does that play out?
Yeah, that's a good question. So it really differs depending on the medicine. The more common thing is if you miss it, to take it as soon as you remember, but if it's right around the same time as that next dose, to just forget about it and just continue on, and oh well, you missed it. There may be some exceptions to that. So when you're picking up a prescription, that's a great question to ask the pharmacist. What do I do if I forget a dose? Or if my child, doesn't get their dose at school and then they come home. More often than not, if it's too close to the next one, just forget it and move on. Yeah.
And so how important is it to continue giving medication after the child starts showing that he's feeling better?
Yeah, that's a great question. So with things like antibiotics, anti-infectives, most of us have experience with that, whether it's an ear infection or sinus infection or strep throat or something, and they're taking an antibiotic. It is really important that they finish the full course, and that. So if you're giving your child, liquid medication, if it's a young child and they can't swallow a tablet, for example, it may not mean the whole bottle, so you do want to make sure that it's very clear from the pharmacist how much. That okay, it's 7 days worth or 10 days worth. And sometimes it can be very helpful to just put a mark on the calendar and to note when you've given those doses. So, an example would be, imagine you have a bottle, this size, but you really only need a portion of it, and the rest of it will be wasted. You don't want to keep going until it's done. I mean, that's overdoing it. I mean, it's not going to hurt the child most likely, but why do that? But you do want to get that full week of medicine in the full 10 days, whatever is prescribed. If you don't do that, and there is that temptation to say, gee, after 4 days, my kid is doing well, I'm just going to quit it and maybe I'll save it for next time, and that's not a wise move. One problem that can result is that, so what happens is you take the medicine and it starts fighting off the germs, right, fighting off that bacteria. The kid starts feeling better, and you say, great, we can send Johnny back to school, and he's going to be just fine, and forget the medicine. Well, what happens is you're killing off some of the bacteria, most of the bacteria, but the stuff that's left in there, there's still some bacteria that could be causing the problem, whether it's strep throat or something, and then that can kind of come back with a vengeance. And so, and then you're regretting that because now you have to go. Then you say, well, gee, now I have to go see the doctor again, or so you can really prevent that from happening by taking the full dose. The other thing you can possibly do if you don't take the full medicine is contribute to the growing problem of resistant bacteria. Because what happens again is you kill off the most susceptible bacteria first, and the ones that are kind of stubborn, right? They hold on, and they're in there, in that sinus cavity, and I'm not going to go quite yet. And if you continue the full course, then most likely you're going to kill off even that really hardcore resistant bacteria, or the bacteria that's holding out. If you stop too soon, the really aggressive stuff is going to come back and make it even harder. So it is really important to stick with that full 7 days, full 10 days, whatever it might be. But again, I think making those marks on the calendar and knowing how many doses you've given is a good way to go. Another point that I just thought of too is that sometimes you might be, here we're talking about something for an infection, so something that's acute, that's not long-term, chronic, and sometimes that might be a twice-a-day dosing. And so if that's the case, asking the pharmacist, how critical is it that this, what do you mean by twice a day, right? So, and gee, it's already 2 o'clock when I'm picking this up, 2 o'clock in the afternoon. Right. Am I supposed to still give this twice, or should I just give 1 dose and then start tomorrow morning with the twice? And, it all depends on the time and the medicine, so it's always a good question to ask the pharmacist, should I still get 2 doses in, even though the day is almost done, or should I just give 1? And those kinds of questions.
The other question that occurs to me is if you do have medication that is left, storing it, and then if similar symptoms happen, within the expiration date, is that a good idea?
I mean, that we discourage against that, and because first of all, the medicine is prescribed for that particular person in that particular time and place, with the symptoms they have, with the doctor makes that judgment call to say, this is what I think you have, and this is what will treat it. And so, trying to use leftover medication for something else, first of all, you're probably not going to get the full amount you need. It may not be the right medicine. It could be out of date. There are lots of reasons not to do it. Now, so then if you're not going to use it, and I would recommend not using it on someone else or saving it for some other occasion. But then what do you do with it? Right? And we don't want to see people pouring it down the toilet. So, they definitely are finding more and more medicines in our drinking water, and they can't filter that out. And so we don't want to see people pouring it down the drain. So then you start thinking about how can you dispose of this. And you can throw it in the garbage, okay? You can add things to it to make it unusable. You can add coffee grounds, you can add kitty litter. If it's capsules or tablets, you can crush them up and add water so that essentially it makes it unusable for a person to use. And that's typically one way to do it. To do it. The other idea is to save it for a medication take back. I know in our community, just last Saturday, or maybe 2 Saturdays ago, they had a medication take back where people could take their medicines to one of the pharmacies in town and just say, here, this is stuff that I'm no longer taking, or my child's not taking anymore. And then what they do is they properly dispose of it through incineration, where they burn it, and then it doesn't get into the groundwater, or it doesn't get into the soil, it doesn't get into the groundwater.
Oh, that's
so
interesting.
So certainly thinking about that. So stop yourself if you're about to pour medicine down the toilet or throw it in the toilet.
And not something I would have ever given any thought.
Yeah. I mean, we certainly if you're rinsing out a cup, that's getting into the water, but it's another thing to take a whole bottle and dump it.
Absolutely.
And you don't want to be doing that. So.
Right.
Yeah.
So when you get a prescription from the pharmacy, how do you read that?
Yeah. So fortunately, the pharmacist knows how to read those, because sometimes they're hard to read. And sometimes, of course, we don't even see the prescriptions anymore. They'll send it over via fax, or they will send it electronically. But certainly to give it as written. And one thing I wanted to communicate was that pharmacists, when they have a prescription written by a physician or some other prescriber, and they type in everything to create that label, it has to say exactly what the doctor wrote. Okay, so that example I gave earlier, if the doctor wrote, take or give 5 milliliters or 1 teaspoonful twice a day until gone, something like that, or twice a day for 10 days. That's what the pharmacist has to put on the label by law. Now, you as the parent, then you might look at this and say, and I really recommend that you read the labels before you leave a pharmacy. When you're picking up a prescription, if the pharmacist doesn't do it, take it out of the bag and read it before you leave. You can. One thing is you can certainly make sure that you're getting the right medicine. If, there happens to be 2 John Smiths, well, which one are we getting here?
Right.
So you can catch that kind of mistake. But you can look at it and read it and say, I do have a question about that. To ask yourself, how am I going to fit that into my day? How am I going to fit that into my child's day? Especially when you have a child who is going to a daycare or a school age. How am I going to fit the 3 times a day in, or the twice a day? What will that really look like? So, you're looking at those directions, and you're right there in the pharmacy, and even if there's not a pharmacist there to say, I have a question for the pharmacist, and then they can come over and talk with you and explain what that really can mean for you. And I know when I teach the pharmacy students, I tell them to ask the patient or ask the person who they're dispensing this to, how do you think you'll fit that into your schedule? Because that forces you to think about it right now. And then you'll usually generate that question of, well, it says twice a day and it is already late in the day. How am I going to handle that for the first day? So, yeah.
So when you're looking at your prescription, when you take it out, the label.
Right.
How do you read the label on the prescription bottle?
Yeah. So I do have an example here, and it's pretty busy, but I'll try to walk people through it. I just wanted to, and we've all seen prescription labels, and every pharmacy it's a little bit different. The one thing I want to stress is that you do always want to read the label, like I said, and why not do it there? Sometimes you've got a child pulling on you and it's not possible, or a child crying, or or if you're in the drive-through, I would actually recommend not using the drive-through for folks who use a drive-through pharmacy. Sometimes you have to because you have a very sick child and you don't want to bring them out of the car again and it's cold. And but you have the potential to get much more or much higher quality interaction if you're face-to-face standing there rather than in the car shouting or So anyway, but to read that label, even if it's at home once you get there, and on a prescription, even things that are refills, when your children are taking a chronic medication that you get every month or every 3 months, still take a look at that label and make sure that it says what it needs to say, and that nothing has changed apart from 2 things. So this is an example of a label, and everything is the label is labeled, right? So everything is labeled and points everything out. And every pharmacy has a different take on this. And there are some pharmacies now. I know that Target does this now, where they have it so you can actually read the whole label without having to turn the vial around. Wonderful, right? Yeah. I'm hoping that other pharmacies will follow suit. But sometimes you're having to do this as you're reading it, and it's kind of tricky. But they're all going to be formatted differently, but they all have these same content items. And if you're picking up a refill, there are only 2 things that really should change, and that is the date that it's been filled again. Okay, so if you called in and said, I need to pick up a refill for my child, and okay, we'll have it ready for you, it will have that date on it, and then it will also tell you, often on the bottom somewhere under quantity, how many refills are remaining. And I know from having practiced as a pharmacist, it is helpful when the person does pay attention to how many refills are remaining. It delays care. It delays us helping people when a patient or a parent comes in and says, I need this refilled, and lo and behold, there are no refills. And then then the phone calls have to be made. Unfortunately, pharmacists are not able to just grant that refill. They have to call and get that okay from the doctor's office. And so paying attention to that and realizing that those are the only 2 things that should change. You should never see the doctor's name change, the medicine's name change, the amount of the medicine. That should always stay the same if it's a refill.
Okay, that's
interesting. And that's a good check. Again, just to make sure that nothing. It's a safety measure.
Let me ask you real quickly, and this is not something that we talked about, but tell me about generics and name brand. Is there a huge difference? Is it always okay to go generic?
Yeah. It's not always okay to go generic. So it's a pretty complicated topic, to be honest. And I do, in a future slide, refer people to a place on the Food and Drug Administration website where there's a question and answer about generics to help with this. So some people insist on brand name, and brand name is the medicine that originates from the very first company that made it, okay? And that they're the ones who have the patent, who have the permission to make it. Essentially, it's their secret recipe that they hold close to them, and they are the only ones who can make it at first, okay? When that patent expires, then what happens is that recipe can be shared, and it's public knowledge. And so other companies who specialize in making generic medications will pick that recipe up and say, I think this would be worth it for us, and then they manufacture that.
Oh, okay.
They make that, okay? Some of the differences can be that, the original brand name medicine is the one that's tested more, okay? This is the one that is tested in things like clinical trials where they give it to all these different people and they watch them and find out, are they helped, is their illness improving, how much is it improving, and so on, and are they having any side effects and what kind of side effects? They study it very closely. Now, it's the same recipe then that this other company is making, and so essentially it should be the same medicine, but they don't go through the clinical trials. Okay? What they do is they do testing to make sure that if you're talking about maybe a tablet or a capsule, something that you would just put in your mouth and swallow, that it dissolves at the same rate and gets into your system at the same rate.
Right.
So, but they don't test the effects of it. But it's assumed that if I have a favorite recipe and I share it with you, and if you make it exactly the way that I make it, it should turn out the same.
Right.
And it should taste the same, right? So, and they do have very strict what they call good manufacturing practices that the FDA regulates, and they go in and they inspect all these companies, and they want to make sure that, all right, you're making this drug, you're making this medicine, and you're using the same recipe, and you're using the exact same equipment and procedures that the other company does. The other interesting thing is sometimes generic medicines are actually the generic companies will buy the bulk medicine from the original manufacturer. So they'll have these big drums of raw product essentially shipped to the generic manufacturers, and then they make the tablets and then package it and ship it out. So then it's really the same drug coming from the manufacturer. But you don't know. You don't know. But really the bottom line is that pharmacists in particular, they go to school, they learn so much, it's amazing the stuff they learn. They go to school for at least 6 years, so they do know a lot about medications. That's their specialty, and they know about the nuances of generics. And there are some medicines that if you've been taking the brand name, you would not want to switch because you will most likely respond differently to the medicine. But the pharmacist knows about that. So, they're a good resource ultimately
so again,
for that.
Talk to your pharmacist.
Yeah, I'm a pharmacist. I have to speak very highly.
Well, and I think that's a good idea.
Yeah, so a long answer.
Interesting. So tell me a little bit about storing medications.
So storing medicines. So, one of the biggest things, take-home messages, is keep it in the original container if you can. Sometimes we do like to move it around, and I'll talk about options for that, storing it in different things. But it's really best to keep it in the original container. And those containers that, like for example, we're talking mostly about things that you take by mouth, and a little bit later I'll talk about other kinds of medicines. But they come in what's called kind of an amber-colored container, that kind of orangey color. And it's colored for a reason. That helps to keep the sunlight out. And the cap on it, when it's on there tight and completely, that keeps moisture out, so humidity. And so it's really important to keep it in that original container if you can. And then, of course, it's not only kept safe in there, but it's still with the label, so that there's no doubt that, that's the medicine, that's that medicine, right? When you do start transferring it into other things, and I'm kind of guilty of, but I feel like I can do it because I'm a pharmacist, right? But I do have my little container where I put my ibuprofen for when I have my headache or that kind of thing. But it really, you have to be careful because at some point you put these tablets in a little container and then you say, I don't even know what that is. I don't even know how long it's been in there. Is it out of date? So you do have to be really careful, yeah. So keep it in the original container if you can. Keep that lid on tight. And part of that is just safety because, if you have children in the house or pets, if something gets tipped or it can be accessed by a small child, obviously they can take that and it's very dangerous. And really, most medicines are intended to be kept at what's called room temperature. And that means, basically, any temperature that you typically keep your house at when you're there, something that's just a comfortable temperature to live in, that's room temperature. So really, kind of the flip side then is that you want to avoid keeping your medicine where there's a lot of humidity. Now, in Wyoming here, it can be very dry, but where in the house can it be most humid? Right? The bathrooms, right? And so even though we have medicine cabinets, and that's what we call them, that's really the worst place to keep medicines. It's ironic. Or even, I know sometimes, when I'm really cooking up a storm in the kitchen, I notice that the steam accumulates on our windows. And so, I wouldn't want to keep my medicine right above the stove where all the steam is rising from the boiling water and that kind of thing. So those are two places to avoid. And so that makes it tricky because then it's like, well, where can we store them? Now, you could store them in a bathroom where you're not showering, if you have a powder room or, a smaller bathroom. But again, you just want to make sure that it's not, you don't have the humidity. You can keep it out of sunlight, so you wouldn't want to put it on your windowsill where you're growing your herbs or whatever, where it's really sunny. So you could, potentially keep it maybe in a cabinet in the kitchen if everything has child-proof caps. Or some people do go and purchase, there are, I'm sorry I don't have a picture of it actually in this presentation, but you can purchase things that allow you to lock up medicines, especially if you're worried about, your child getting into it, if your child's kind of sneaky, or if you have medicines that could potentially be abused. There certainly have been stories of people missing medicines. Say they have Vicodin in their medicine cabinet or something, and then they're selling their house, and there are people coming in and out of their home, and people report missing medicine that is potentially abused. And so there are ways to lock it up and to buy small cases to lock it up in if you're worried about that, or to keep it at least out of the reach. So I know we actually in our kitchen at home. When I was needing to give children's allergy medicine to my son, we were keeping it. It's all, you can't open it very easily. You have to really push on it, and so it's a child-proof cap. And we just kept it in our kitchen cupboard on a higher shelf, and that way it's accessible. It's not in the sunlight. It's not where it's really humid, and that was a useful place. So, and actually, I wanted to mention, not in the car. I've heard of folks, taking, leaving things in the car. It might be in a purse that sits in a car for a long time or in the glove box. And, our cars can get so hot with the sun shining on it. And that what happens is with the humidity and with the heat, it degrades the medicine. It basically, causes the medicine to go bad faster. And so you really want to avoid that kind of situation and not leave things in the car for an extended period of time.
That's good to know.
Yeah. And then there's the refrigerator, right? So if it says to refrigerate, you got to keep it cold. You don't want to freeze it though. You want to make sure not to freeze it, but you keep it in your refrigerator. And that's tricky too because do you put it next to the ketchup? You have to figure out where in the refrigerator it's not going to get lost or spilled, or make sure that cap is really tight. If you have a child who is young enough that they could get into it and not know better, making sure that you have the childproof cap, because of course if they can open the refrigerator, they can get to it. So, and if you're having to transport that medicine, beyond just bringing it from the pharmacy home, or for a long period of time in the summer, bringing a little insulated container with an ice pack in it, the way you would if you were trying to keep your sandwich meat cold, or something like that. Right. Same kind of idea. Yeah. Now, I do have a note here to only keep it in the refrigerator if it says to. I've heard of people taking some kind of liquid medicine and they'll put it in the refrigerator even though it doesn't say to. Because some things you don't have to, and you think, oh, it's the pink stuff. Really, this should be, but no, it doesn't say it. And if you're doubting it, ask. But if you put it in the refrigerator, sometimes it can get so thick that you really can't even use it. I mean, it just, you can't draw it up in that oral syringe or whatever you need to do. And again, those manufacturers, they test everything out, and they find out what is the best temperature to keep this at. And so, you want to pay attention to those directions because they do mean something, and they do help to keep the medicine fresh, whether it's keeping it in the refrigerator or keeping it, in a low humid room temperature place. So, okay, so Pillboxes. I know that people use these, and they can be really helpful. And so, this example the picture that I have on here, it's colored, and some of them are clear, some of them are purple, blue. They have all different colors. But certainly, if it's not the amber bottle, then it can let in some of that sunlight. Now, you usually only put in maybe a week at a time. So, you're going to be using that up. You're not going to have that sitting there for months and months. Okay. Right. So, the keeping the sunlight out, you still don't want to put it on a ledge in the sunlight on purpose. But it's not as I guess it's less critical if it's only a week at a time. Okay. So it helps you to organize. It helps you to remember because you can open up Monday and here's the Monday medicine for my child. Okay. And that's really that can be really helpful for a parent because then, if you're busy and then you can look and say, oh yeah, we did give the medicine today. Right. Especially if you've got multiple children, you've got a very busy life. Now, realize though, of course, that most of these are not childproof. And so then knowing where you're going to keep this out of the reach of small hands is really important. And
they taste good.
Yeah, right, because some things do taste good. Yeah, they will formulate it. Some of the chewables, they put in sweetener, right? Yeah, absolutely. Again, to stress that only 1 week at a time. And to really use it as a week. So I have seen people use these kinds of storage containers for pills. And instead of putting the Sunday, Monday, Tuesday, they'll put, one type of medicine in Sunday, one type of medicine in Tuesday. And, it's just more confusing,
it is.
And so really, use it for the way it's designed because it works really well because then you really do remember, oh, yeah, I already took this. Or you open it, oh, we didn't give you your medicine today. Yeah. And to just keep track of what you've put in there. Right? Because again, you're removing the medicine from the thing that's labeled. So now it's up to you to know what's in there. And so, if your child takes 2 medicines, you should be familiar enough with it to know that the little round, pink one is this, and the long white one is this other thing, and to know that, and which one is which. They also have these more complex ones. When we have really more complex regimens where there are different medicines and they're taken at different times of day, and they can be very useful too. And so that might be a good choice. And really, pharmacies sell these things. I mean, you can buy things online as well. But if you stop at a pharmacy and you look at what they have, you can certainly ask the pharmacist, this is the regimen, what would you recommend? What do you think would be easiest if I were to use this kind of thing? Yeah. So can I talk about how to cut a pill in half?
Absolutely.
So of course, if you've got a capsule, you cannot cut those in half, right? If you tried to, it's going to get crushed and powder is going to go everywhere. If you try to open it, it's almost impossible to, you can't sit there and try to figure out how much is half. So if you ever get a prescription and it's a capsule for your child and you think, I don't think my child can swallow this capsule, because they're harder to swallow sometimes, they kind of get stuck. Then you have to ask for a liquid formula.
Okay.
And a lot of times they do have that option. Now, if it's a tablet, some of them are scored, which means that there's a little line going down the middle, and that makes it easier. Some of them are not scored. But when you use a pill splitter, it has that tiny little razor blade in there, and they work amazingly well. And and they are the safest way to cut a pill in half. Sitting there with a knife trying to do it, or a razor blade, too risky. First of all, you're not going to get an accurate cut, and you might cut yourself and everything else. And they're very inexpensive. And they're, so again, and they work really well. And you can maybe even cut a couple ahead of time if your child has to take, is prescribed take a half a tablet. Then you can cut a couple ahead of time and put them in the vial, and then you're ready to go for the next few days.
So sometimes when you've kind of hit on this a little bit, but kind of if you could talk a little bit about following the directions.
Yeah.
And diluting, not diluting. You've talked a little bit about going to school, but you've got some great ideas.
Yeah. Well, so the first thing that I would love to touch on is how directions can be kind of confusing. And again, when it might be directions on the package from that you just bought some cough and cold medicine or pain medicine from the grocery store, or it could even be confusing when it's on a prescription label. Certainly, kind of the policy of if you don't know, ask is always important. And I really, there really aren't stupid questions, because this is your child. This is your child's well-being. And
right.
If you have a question, ask it. But this classic example of every 4 to 6 hours, you'll see that on prescriptions for pain medicine, for example, or even pain medicine like Advil or Tylenol for children. And what does that really mean? So one thing that it means is that you're not supposed to give the medicine any sooner than every 4 hours, right? So you may have a child who's very sick, and that giving them this pain medicine is really kind of taking the edge off, and they're able to sleep, or maybe they're not able to sleep. Maybe it's daytime, but to know that, all right, I gave a dose at noon. The soonest I should give it is 4 o'clock in the afternoon. And there's a reason for that, because the way that the medicine works in the body, and you swallow it, it gets absorbed, and you end up having a level of medicine in your blood that is working and moving all over your body to address the aches and pains or whatever it is. But eventually it starts going down because your body starts processing it in whatever way, depending on the medicine. And then when you give that next medicine dose, it brings it up again. Okay. Some medicines will work better, especially with pain, to make sure that you do have that kind of consistent level where you do give it every 4 hours, at least for the first day. If let's say that your child sustained some type of injury, and they're just in a lot of pain, to give that every 4 hours if those are in the directions for the first day. And that will help keep that pain under control and not have that breakthrough pain when suddenly they wake up and they're in agonizing pain. It could actually be worth it that one night to wake them up and give them the dose and then let them go back to bed, things like that.
Right.
But a lot of times, of course, you don't want to wake up your child, And even something that, even if it says give this every 6 hours, well, you probably don't want to wake up your child. So you do the best you can. You give it right before bed and right when they wake up and then, squeeze it around the rest of the day. So going back to the every 4 to 6, again, if you wait longer than 6 hours, then the effect of the medicine wears off, okay, because it starts to leave the body or get used up essentially, okay. So that's why they would say something like every 4 to 6 hours. Sometimes that can also mean that you don't want to take any more than 6 doses in a 24-hour period, and that can be really critical when it comes to medicines that really have a really clear maximum amount of what you should take in a day. And that certainly varies with children. Their bodies are so much smaller, and they process medicines differently than adults. So, again, if you have a question about that, so does this mean that I could give up to 6 doses in a day? Ask that question. And it may be yes, and it may be no. There may be some exceptions. So to ask that question,
That is good to know.
So for diluting medicines, a lot of times, most often, medicines come exactly the way that you're intended to take it. And that goes for our kids, too, our kids' medicines. It's a rare thing when it says that you need to dilute it, okay? Because usually they do that back in the pharmacy so that it's ready to go, okay? Sometimes when it could be a big question mark is, I can't get my child to swallow this, and I'm going to just mix it up in their applesauce, or I'm going to mix it up in some kind of food. I would check on that. Some foods might be very acidic, or and do something to change the medicine. So it's that, again, that's a good question to ask. Can I mix this with applesauce? And sometimes you picture like those little containers of applesauce. Mm-hmm. Now imagine that you have a child who's not going to eat that whole container, and you're putting their medicine in it. Well, what's going to happen? Well, some of that medicine is not going to get in them, right? Mm-hmm. So to really think through, if I've been given the green light, the go ahead to mix it up with applesauce, then maybe I'm just going to choose a very tiny amount that I know my child will eat. Right. Or at least I'm pretty sure they'll eat, right, and not fling everywhere. But that can be really tricky. I've been there.
Yeah, that would be.
Yeah,
that would be.
Yeah, absolutely. Yeah, because you want them to get the whole dose.
Yeah,
so that it works. Yeah, yeah. So what about if your kids are going to a daycare or a school? I never knew this before I went to pharmacy school. Actually, some of this, I was so surprised. I guess I didn't know it even through pharmacy school, and then when I got out into practice as a pharmacist, I thought, well, why don't we do this for people? Mm-hmm. So the point about, if you have a child who is taking medicine during the school day, you can ask that pharmacist, could you print out another label another vial, and that way I can put some of the medicine in there and send it to school. Good. And we can have some at home and some at school. Yeah. And that just never occurred to me, as I was going through pharmacy school. But then you get that request and you're problem solving and you think, oh, well, we could do this.
That makes so much sense.
Yeah. And, it's just a few extra cents in terms of money for the pharmacist to give you an extra label in a vial. It's not a big expense for them. And it really doesn't take much more time either. So definitely thinking about that as an option. The other is that, to provide any kind of printed information you can about the medicine that your child's taking to the teacher or to the school nurse. I put teacher on the slides just because I know a lot of schools don't have a full-time school nurse, and that way they at least have some information about it, and they're not, in case they're wondering about the medicine and they see something going on with your child. But to let them always know if something is changing, even if it's, the child is still taking something at noon, mm-hmm. but we noticed a change in how this tastes different, and so, she might be a little bit more hesitant to take it, and you might have to, convince her of the benefits of it, or, that kind of thing. But to realize that any little change can certainly affect your child's willingness to take the medication or their ability to take it. Yeah, so to let the teacher know.
That's good to know. You've got an excellent resource on keeping the list of children's medications, which is something I always intended to do, never mm-hmm. did do, but this is wonderful.
Yeah, so this particular one, I've provided the URL, the internet address, so that you can access this and print it out and fill it out. And really, it says, when I get up, I take. Mm-hmm. So, if you have a child who is old enough to be able to fill this out themselves, or that you could sit with them and fill it out, that's even more empowering. To have them involved with that as well. And really, I recommend this kind of thing for anyone who's taking medicines, whether it's you or your child.
That's just a good idea.
Yeah.
They always ask at the doctor's office.
Oh, yeah.
Whether you're, to have that available would be very handy.
Yeah, and it's just nice because it cues you into not just the list. A lot of people, some people might have at least the list. These are the 5 medicines, mm-hmm. but it's really helpful for the doctor and for the all the other healthcare professionals to know how much, when it's taken, who's the prescriber, if it's a different doctor, if your child has more than one doctor. It's just really nice to have all that information in one place.
That makes sense.
Yeah, and to have sometimes I like to have that multiple copies so that each parent can have a copy, maybe in their wallet or their purse, something like that.
That would be a great idea.
Yeah.
So tell me a little bit about medicines that you don't swallow, that the children would not swallow.
So this particular website, it's the same website as the last slide, with the form that can be filled out. They have some really nice examples of how to administer things, like how can you use an inhaler with your child, or how can you put eye drops in your child's eyes, or ear drops and things like that, or a nose spray. And so it's just a great resource to be able to watch it. I mean, there are examples on there to look at. Yeah.
So what would be some of your overall tips on what families should do?
Yeah, well, as a pharmacist, one thing I've learned is that it really helps if you go to the same pharmacy, because if you're getting prescriptions for your child, let's say that you usually go to pharmacy A, and that's where they know you and you go there regularly. But now your child has strep throat, and you go to see the doctor, and you decide to get it at another pharmacy that's just right next door. It's very convenient, and I don't want to say, oh, don't ever do that. But what happens is, if you do that, that pharmacy does not know all of the other medicines that you've gotten filled for your child. If you take the time to go over to that other pharmacy that you usually go to, they have all that information on file. So pharmacies, by law, throughout the country, they keep profiles on people. And so, if your child had a prescription 3 years ago, it's in the profile. If your child has been taking the same medicine for the last 12 months, they have that on the profile. And then you bring in a new one, and the pharmacist can then look and say, okay, this is from this doctor, this is from this doctor. I don't know if they've talked, but I have all the information, and this looks okay to mix, to take together. Or they might say, this doesn't look like a good idea, and I wonder if this latest doctor really knows about this other medicine that your child's taking, because maybe you didn't have that list, and you forgot to share that information. And so having all that information in one place is more guaranteed if you go to the same pharmacy every time.
That makes sense.
Yeah.
That makes sense.
Yeah.
So one of the things that you've talked about, and I think is how accessible pharmacists are. So if you wouldn't mind just kind of...
Yeah, absolutely. So I do believe that we're one of the most accessible healthcare professionals in a community. We typically don't require an appointment. So, a pharmacist working at, a Kmart or Walmart or an independently owned pharmacy, Albertsons, all those types of locations, you can call and talk to the pharmacist. You can walk in, and you might have to wait a few minutes, or, and you can talk to the pharmacist. The thing that does make it hard is that pharmacies are busy places.
Yes, they are.
And so, the pharmacist may not seem as accessible as you want them to be. And so, they might be on the telephone, or they're behind a computer, or they're further back, and you certainly can't reach them. You have to somehow call to them or ask. Usually in a pharmacy you have pharmacists and you have technicians, and technicians are the support staff. And so, they have not gone to the 6 years of school. They are very capable of doing the jobs that they're given, but they're not the experts in medications the way that pharmacists are. And so, if you're face-to-face with a technician and you have a question for the pharmacist, I just have some examples here because it can be a little intimidating. And so to just say, I need to talk to the pharmacist, or I have a question for the pharmacist, and I'm willing to wait. Or, is there a time when I can come back or when I can call? Because, I know I've worked as a pharmacist before, and it can be busy, and you might see someone, oh no, that person needs to talk to me, but I'm on the phone with this doctor, and there's something else that there's a patient who is, really in need, and they were here first, and whatever.
Right.
And you have to triage. You have to kind of make those decisions and say, well, this has to come. This is a higher priority than helping this person who's just walked in. But really, it's the pharmacist's responsibility to answer those questions, and if they don't have the answer and they can't possibly have every answer, then they look it up for you and they get back to you and they call you. So. Yeah, so I can't stress that enough, that it's so important to just take the time to ask and to realize that you have to overcome those barriers.
Right.
Yeah.
So how would you kind of summarize the whole talking to the pharmacist, using new pharmacies, using your regular pharmacy? What would be some of the things that you would say?
So there's some nice, there's a list of questions that come from a great organization called the Institute for Safe Medicine Practices, or Medication Practices. And so the next several slides really highlight these questions that they recommend asking, or at least knowing the answers to when you're picking up prescription medications. And the Institute for Safe Medicine or Medication Practices, it's a great resource. So just going to that website and looking around, I mean, there's a lot of information for consumers there, as well as healthcare professionals. So the first thing they recommend is knowing what the brand and generic names of the medications are. And so you have that working knowledge of those names. And that can be really helpful when you're talking with one of your healthcare professionals and they use one name and you're familiar with the other one, let's be familiar with both of them, and that way you know what they're talking about. Now, if you have been given the generic and it's working fine and you're fine with that, then we typically don't use the brand name, because the brand name does refer to the brand name, if that makes sense. So it's kind of like saying, if we had a box of Kleenex here that really wasn't Kleenex, which is a brand name, then technically it's a box of tissues, right? And so, it's the same kind of idea that technically it's not Kleenex if it doesn't say Kleenex brand on there. Right. So, yeah, but it is helpful to know those, because, it might help when you're reading material. You might have found some good information to read, and it uses the brand name, and that way you're talking about the same medication.
Good to know.
And the resource there from the Food and Drug Administration is kind of a question-answer format to learn a little bit more about generic medications. Certainly knowing what it looks like, especially that's especially important when when you're picking up a refill medication. Sometimes you're just handed that bag.
Right.
I like to rip that bag open, take that staple out, and look at it. Again, is everything right? Is this really what I'm expecting? And if the pharmacist doesn't do it, to open it and look at it before you walk away. Pharmacists and technicians are human, and even though there is such a heavy emphasis now on making, on minimizing errors, reducing errors, so that patients are kept safe, errors can still happen because we're human. And so, one big thing you can do is right away open it and say, is it supposed to be blue? It used to be white. And then they can say, oh my gosh, we need to fix that. Or it might be that, yes, it looks weird, but now it's blue. They just changed it. And that happens. Sometimes, it's a different generic manufacturer, or they just decide to make it a different shape or different color, or, but every tablet and every capsule, and certainly, when you're talking about liquid formulations, they have different flavors and things like that. But, they all have their own little characteristics. And so, for example, tablets, they have their color, their shape, and they have the markings on there. And sometimes it's the line, which they call a score. And then they'll also have numbers and letters, and that identifies that exact medication. So knowing what it looks like is really important, because then you're getting what you got last time.
I can see that.
And there are nice resources that pharmacists have where, let's say that you find a tablet and you're thinking, oh my gosh, I don't know what this is. Where did this come from? Well, you can call and they can look it up and they can identify what that exact medicine is.
So that's good to know.
Yeah, sounds pretty nice. Some other questions, things like, why is my child taking it? Really, it's important to know. Right. Hopefully you do trust your doctors and, that they're doing best for your child. But you should know what your child is taking each medicine for. That this one might be to help them breathe better. This one is helping for, their allergies. This one is helping for maybe, their mental health. And to know what each one is for. Yeah. How will you know the medication is working? Good one. Wow. So, I talk so much about this with my students, because I think, why would anyone continue taking a medication if they don't think it's working? Why would anyone continue giving it to their child if they don't think it's working? And it's harder with children, right? Because if the child's so young that they can't report it, that's pretty tricky. And sometimes, I know, as a parent, at times I'd have to ask, I'd hold a little teddy bear or a doll or something, I'd say, so are you still having pain, or is it still, where is the pain? And, I would have them show me on the teddy bear or something like that, just because it's so abstract, I think, for children. But anything you can do to determine, is it working, and to ask, how will I know this is working? With your child, then you should notice this difference. And sometimes with medicines, it's almost immediate, and sometimes it can take 2 weeks, 3 weeks if it's a chronic medicine. So asking those questions, how will I know it's working? What signs should I be looking for in my child? Or what should, if I ask them, what should I expect them to tell me? So, and some things can be measured. If you have a child with diabetes, you may be checking their blood sugar levels. Right. And then, you have that glucometer and you can see the numbers. But it's not always that obvious, right? Sometimes it's just that I'm feeling better, or I feel happier, or I don't feel as much pain, or I can do the activities. I know as a parent I could say, my child's not lounging around on the couch anymore. They're up and moving, and they're asking, what can I do? What can I work on? Okay, they've got the energy back. They're feeling better.
Right.
But it's not always that obvious, so asking about that.
Yeah, that's true.
How much should they take and how often? Just making sure that you understand exactly what that is and how you're going to do it. And again, how will I fit that into our schedule? Because you can have a very busy family schedule. And to think about that ahead of time. When is the best time to give it? Again, sometimes it just says once a day. What does that mean?
Yeah.
Does that mean morning? Some medicines are better given in the morning. Some are better given in the evening. And sometimes that can be because of the way our bodies work in terms of our diurnal rhythms. And sometimes it's because it causes a little bit of tiredness, and so take it at night, and that way it doesn't matter because you're sleeping.
Right.
So just knowing the best times. And knowing how long, how long does she need to take it? So, if it's an antibiotic, is this 2 weeks? Okay, I have to give it to her for 2 weeks. Or is it a chronic medicine? Is this something she's going to have to take for the rest of her life? Will she outgrow this? Does that ever happen? Asking those questions so that you have an idea. And that helps, when you're talking with your child, too.
Absolutely.
And then I think this is the last slide about these, but, what side effects to expect? And what do you do if they happen? And this might not be something you ask, you might not think to ask this, but lo and behold, your child's taking something and you think, now they're complaining about this. Is this the medicine, right? And, and again, pharmacists, I think, are especially in a good position to try to troubleshoot that because they have a really good idea about side effects, what can happen, and, it might be that, you call up and you say, I started giving, and having good information is always helpful. So, I started this medicine 7 days ago, and this wasn't happening, and now this is happening, and this is a problem. This is bothering my child. It's bothering our family, or and I want to do something about it. That can help the pharmacist to know, how severe it is, whether they can really attribute it to that new medicine, or maybe it's something else completely. I remember getting a question when I was out in practice, and the parent said, I think this is a side effect of the medication, and everything I looked up and read, I didn't see any evidence of that. Now, and the medicine had been around for a while, and so I said, I really think it's something else. So, this is something you want to call your doctor about if this is troublesome to you, because I really don't think it's the medicine.
Right.
So you just never know. How about, does it interact with things? I know a big question that people ask is, can I take this with food? Should I give this with food, or without food? And, some of that is, sometimes it's, give it with some food because it'll be easier on their stomach.
Right.
And sometimes it's give it with food or don't give it with food, and that's going to make the medicine work better. So knowing that distinction, I think, is really helpful as a parent, because if your child is refusing to eat, well, maybe we can just try it without the food, and it's not going to affect the way the medicine works. It might make you feel a little, kind of icky, a little upset stomach, but the medicine's going to be okay, or it's going to work okay. So knowing that difference, and some of the big culprits with food, dairy, stuff that our children really consume a lot of, right? Milk and cheese and yogurt. There are some medicines that say they don't get absorbed into your system. If you're swallowing it while you're drinking milk, and milk is in the stomach at the same time, or cheese is in the stomach at the same time, it can affect how the medicine works. Other culprits include things like certain types of vitamins or supplements, calcium, iron. They can affect things too. So asking that question is a good one too. And that kind of gets back to that idea that we talked about in the beginning about sharing all the things, telling your healthcare professionals, these are all the things that my child is all the types of medicines. Even if it's an iron supplement, or they take a multivitamin, or getting all of that information out on the table so that the person you're working with can help you to problem solve and do the best thing for your child. They also recommend this Institute for Safe Medication Practices, just knowing whether it's replacing anything that your child was taking. I can think about, maybe not examples of children, but I've certainly seen examples where adults will come in and they'll have but it could happen with children. and they're getting a new prescription, and the intent is that one of their existing ones is stopping, right? It's going to replace it altogether, but it might not say that on the prescription. And so, and if you didn't have that conversation with the doctor, or maybe you just missed it, you were focusing on your child, and you missed the fact that the doctor said, and then go ahead and stop that other one.
Right.
And so, asking those questions and having that conversation. And sometimes the pharmacist will know, and sometimes they might have to call the doctor's office to clarify. So, and that way you don't take, you don't end up getting what they call duplicate therapy, or, the same medicine or very similar medicine, both of them at the same time. The last few things, what to do if you miss a dose, and we talked about that earlier, that it can vary with the type of medication. And so checking on that, that if I do forget or if she misses it at school, what do we do then? Right? Yeah. And then we talked about storage. And again, every medicine, medicines have different storage needs. And so checking on that and avoiding those high humid sunlit areas, right, and hot areas. So I don't know.
Tell me, you've got a summary on what it is that you should talk to your pharmacist about.
Yeah, so one of the things that I actually teach my students, and they all develop their own way of practicing pharmacy the way they want to, but these are really the three key areas that I like to teach my students to. If when you talk with folks and they're getting new prescriptions, what are the things that you want to make sure you talk with them about? And I like to, I tell them, ask them questions and get this conversation going. That doesn't always happen from the pharmacist's end, and so that means that you as a parent need to ask those questions. But the three topic areas, so those previous slides had like 11 or 12 questions. It's a lot to remember. Right. You can't always stand there and ask all these questions. But the three big areas are, what is it for, how are you going to take it, and what should you expect? And that question of what to expect, it can get at things like, how are you going to know it's working? How do I know about possible side effects and what I should do if there's a certain side effects? There are some side effects that really can be avoided. Right. And there are some side effects that, they might happen and you get over it and it's not a big deal, And then there are some side effects that are very troublesome. And, making sure that you know the difference to be looking for those. Because something, it's possible that something that might not seem too troublesome would be to a healthcare professional, and they'd say, you know what, you need to call me if that happens. Right. You might think it's just something that's not too serious, but it could lead to something serious. And so to know that distinction. And, you can't keep it all in your head, and they're certainly asking for information that you can go to and refer, to refer back to and read. And on some of the materials that we'll be posting through this whole series, there will be a lot of references and resources where you can access reliable information to learn about the medications that your child's taking. So I'm not listing them here, but they'll be in some of the printed materials.
That's great to know. Thank you.
The other thing to stress that a lot of pharmacies have a private place to talk. It's not always used, but they often do. Sometimes they'll have a separate room that you can actually go behind a door. If there's something big going on and you just don't feel comfortable having, everybody around you listening or potentially listening, you can ask, is there a more private place that we could talk? And so that's something to ask about. And then all pharmacies have times when they're really busy and then they're not as busy, really busy and not as busy. Now, it's not always predictable, and that makes it hard actually to work as a pharmacist and a technician because you might think, oh, this is usually kind of a quieter time, and then suddenly, wow, we've got all these phone calls and all these problems that we're working on and all these prescriptions to handle. But there is some predictability, and so, if you know that you need to have more time to talk with the pharmacist, ask them, is there a better time? Is there a time I could call? Or, I'm going to go do some shopping. Could I come back when it's not so busy? And then I could have maybe a few more minutes to talk with you. So to ask, find out if there's a better time, and there really can be.
So, and then if you could just kind of summarize the proper use of medication.
Yeah. So to wrap up, the title of this talk is the proper use of medications, and the three areas that I think of with proper use is that it's safe, and that it's effective, that it's working the way you intended to, the medicine, and that you can hopefully minimize or deal with any possible side effects and handle that well. And so, really this whole webinar captures all those aspects. I'm sure we could spend many more hours talking about some of the nuances of things, but to realize that using medication safely, it's not just for your child, but for your whole household too. So that again, it includes the safety caps and where you're going to store things so that even a pet can't get into it, or a younger sibling and things like that. And to know that the medication's working, how can we know it's working? And how can we minimize or reduce the likelihood of a side effect happening? And to work with your pharmacist and your other healthcare professionals to try to make that happen.
I appreciate it. Thank you for your time.
Yeah, thank you.
I really appreciate it.
Yeah.
This has been the Wyoming Family to Family Health Information Center information, and you can log on to the website or contact the information on the following slide. That information is available online. Thank you. This is Susan Bentley and Carol
Kabelnicki. Yeah, thanks.